Good afternoon and welcome to the National Organization for Rare Disorders bi-monthly webinar for our member organizations. My name is Debbie Drell and I'm NORD's Director of Membership and your facilitator for this meeting. I would like to thank everyone for joining us in this bi-monthly webinar featuring a very special select guest panelists who are executive directors and board members and leaders of our member organizations. This bi-monthly webinar is being recorded and will be made available a week from today. All the lines are muted. As a leader of one of NORD's now 270 strong member organizations, you're entitled to all the resources that NORD provides, including state-level advocacy, federal policy, communications, public awareness, education initiatives, patient assistance programs, natural history registries, research, and CME. NORD's bi-monthly webinars take place on the odd-numbered months, 6 times a year, and is for members only, providing NORD leaders like you with education, information, capacity building, networking, and direct access to resources. During our bi-monthly webinars, we follow the agenda you see on the screen. We always start with welcome and updates, and then we have our panel or speakers and Q&A. The format for this call is those announcements that we give is really news for you, our member organizations. We try to dedicate a portion of our time to Q&A at the end of the call. We really want to do that this time because we collected about 40 questions in advance from the registrants. You can also submit your questions throughout the call, and our presenters will take them either during their talk or during our Q&A time, in the order in which they were received or by relevance to the presentation. How do you ask a question? If you're watching the slides now using the ReadyTalk webinar browser, there's a chat function. It's a circle button on the lower left side of the window, and it's a light blue circle with 2 white speaking bubbles on the left-hand side of the raise hand button. So for the 51 people who are on the webinar, you can use the chat function at any time to submit your questions. You can ask a question anytime, but we will answer them towards the end. If you are on the phone call and you're not on the web, you will not be able to ask a question in this way. So you can send an email to membership@rarediseases.org during the webinar, and we will do our best to ask questions or to answer those questions in the order that they're received. If you ask a question to our speakers that does not pertain to the call topic, we encourage you to ask your question to NORD staff after the call via emailing by emailing membership@rarediseases.org. That email goes to both Lori Oppenheimer, Membership Associate, and to myself. And you're listening to the voice of Debbie Drell, Director of Membership, and I am very happy to give our national updates. As you can see, NORD's mission is that we are a patient advocacy organization dedicated to the individuals with rare diseases and the organizations that serve them. NORD, along with its more than 270 patient organizations, are committed to the identification, treatment, and cure of rare disorders through programs of education, advocacy, research, and patient services. You're so important. You are in our mission. You are our mission, and our missions align through all of these programs that we support. I'd like to give a big, wonderful, hearty welcome to 2 of our newest member organizations, Defeat MSA, Multiple System Atrophy. Their goal is to increase awareness, alleviate suffering, and advance research toward the cure for multiple system atrophy. And they work with the community to support those with MSA and strengthen the education of healthcare professionals regarding MSA. We also want to welcome, big NORD welcome to the Rare Kids Network, which connects families to resources in support of children with rare life-threatening illnesses. The organization provides complex care management services based on each child's diagnosis, with a vision of reducing the burden on children and their families so they can focus on achieving their dreams. So now on to our membership updates and announcements. Rare Disease Day in the United States was a huge success. I want to thank everyone on the call and all of our members who were involved. Rare Disease Day is the biggest day out of the year for awareness raising of the millions of people living with rare diseases in the United States and around the world. NORD is the official U.S. sponsor for Rare Disease Day, and this year we had 178 events that were submitted to the U.S. website, including 5K races, medical student educational events, and so much more. Our Rare Action Network will have hosted 35 advocacy events across the U.S. by the end of April. These events bring the patient voice directly to elected officials to ensure that those officials understand the rare disease challenges that our community faces. NORD's education team supported 20 academic events at universities like Notre Dame, McGill School of Medicine, Georgetown School of Medicine, Keck Graduate Institute, and more. I was on a panel with several member organization leaders in D.C. at Georgetown Medical School, and we educated maybe 40 students, med students, about rare diseases and really got them engaged and committed to our cause. NORD also hosted a tweet chat. What do you do if your child or you receives a rare disease diagnosis? And we co-sponsored that with Boston Children and the Mighty. And the conversation was so vibrant, we reached 1.6 million users on Twitter, and we garnered 19 million impressions. So that was a real huge success in just an hour. And our Handprints Across America campaign engaged 550 individuals on social media sharing their stories. You can see a picture of the littlest participant in our Handprints Across America, and our tweet chat was super successful. Another campaign for Rare Disease Day, just to recap, we surpassed our goal of 7,000 miles. We hit 12,000 miles, and the 7,000 mile rare movement was really an activity that asked for individuals who were affected by rare disease to fundraise and get pledges for walking, running, or biking 7,000 miles. Collectively, we hit 12,000 miles. I would say that my fundraiser did some part in that. I don't think I walked even 50 miles in the month of February, but we all did our part, and we fundraised for programs and services that affect the rare disease population. And not listed here are the NIH activity that NORD supported. NIH did a Rare Disease Day that brought 700 advocates and several of our member organization leaders spoke on panels bringing their experience, wisdom, and insight. So we're very grateful for all of you for participating in Rare Disease Day. It was a huge success in awareness raising. Every webinar and telephone call, we feature a member benefit. This time, it's access to big-ticket events. The World Orphan Drug Congress was a one-track conference that has now become a global gathering of 1,000 leaders in orphan drugs from 38 countries on regulatory pathways, policy, and incentives, all around the drug development and rare disease research that affects our work every day. There's 135 sessions on gene therapies, genetic testing, partnering and investment, expanded access, global patient advocacy, value-based pricing, gene therapy development. Registration starts at $3,000 for individuals, and applicable taxes are not included. However, many patient advocacy leaders have attended in the past. What is their secret? How did they get in? How can anybody afford $3,700? The secret is this. NORD is the official patient advocacy sponsor of the World Orphan Drug Congress, and as such, we are able to provide our nonprofit member organizations with a limited number of free registrations. If you or a representative from your organization would like to attend, we send an email out about this every Thursday in our e-newsletter. You can email membership to get access to that. Our CEO and our Chief Strategy Officer, Peter Saltonstall and Pamela Gavin, respectively, will be there and are the keynote speakers during this event in Washington, D.C. Can't make it to D.C. There are other activities. We are also, as a member benefit, giving out a free ticket plus 50% off for a guest to participate in the Rare Impact Awards. It's our 31st anniversary. We are celebrating the Orphan Drug Act. We're celebrating our anniversary. It's a special activity. If you aren't in D.C. and you can't make it, is there someone on your board? Do you have a leader or an affiliate in this area? Take advantage of this ticket and have the opportunity to connect with industry and other stakeholders who show up to celebrate this event with us every year. So we're looking forward to seeing our members in April and in May in D.C. There are other meetings that are taking place. Just so you know, save these dates. April 4th is our next bi-monthly call. They alternate with the webinars. So calls are on the even-numbered months. Webinars are on the odd-numbered months. We have our bi-monthly call with Paul Melmeyer and others talking about the most latest breaking news on federal policy. And then our next webinar is May 23rd. That's our next regularly scheduled webinar, which will feature Pamela Gavin, our Chief Strategic Officer, and she will be speaking on board governance. She gave such a great talk at our Rare Diseases and Orphan Products Breakthrough Summit last October. Such a great talk to our leaders that we had to bring her back, and we wanted to make sure that if you didn't come to our summit in DC last October, that you didn't miss out on this opportunity. So more information to come on that. Last but not least, we are doing a webinar on PCORI funding, and this is not during our usually scheduled webinar time because the deadline for this, for a special PCORI funding, is in June, and we had to bring her in faster than that, sooner than that, so that you guys could take advantage of this. For those of you who don't know, the Patient-Centered Outcomes Research Institute, or PCORI, was established to fund research that helps patients that care for them with better informed decision with the healthcare choices they face every day. It's patient-centered research. PCORI's already awarded $81 million to rare disease research. This is the last year for funding in the way that we know the program, because it's going to change after 2019. And I learned, after meeting this lady who was our speaker, I learned that PCORI may have funding for you to pay for patients to come to your conferences. And that is really, really helpful support resource for all of you. You're all here for fundraising. Imagine getting money to bring patients to your conference. Eleanor Perfetto is the Senior Vice President of Strategic Initiatives for the National Health Council. I met her at an event in February, I believe, earlier this year, and we talked about this, and I said, you've got to come and talk to our members. You have to tell them about this opportunity for funding. So she's coming, and her primary focus on her work in policy and research is on PCORI and patient engagement in healthcare. So she is a great speaker. We locked down her schedule. She's coming in April. Really want to make sure that you save the date. Not a NORD webinar or meeting, but one that's good for you is that if you want to get involved in FDA's drug development process, the FDA Center for Drug Evaluation and Research is hosting a public workshop. I know what you're thinking. This workshop is in Washington, D.C. on April 3rd. Maybe you can't come. There's a webinar portion. So I just want to draw your attention that there is a webinar portion for this workshop. More information is in your member e-newsletter. Registration closes in 7 days. Really want to just put that on your radar. There's so much going on. Maybe you aren't able to make it, but maybe someone else in your organization can. Very important. And then lastly, related back to PCORI is doing, they're looking for an advisory panel for their research area on rare disease. So if you're interested, these advocates that are on their advisory panel on rare disease will advise and provide recommendations to PCORI's Board of Governors, committees, and staff on conducting patient-centered comparative clinical effectiveness research in rare disease and more. Also patient engagement. So if you want to be heard in research in the work that PCORI does, I encourage you all to look at that. They have a preference for applicants who are patients, givers of care, and advocates, clinicians, industry representatives. Going through this pretty quickly because I want to get to our speakers. We have so many wonderful questions and speakers who will be speaking. The last portion of our announcements are really news that we need your help. So we'd love for you to tell your members. It's not that we want you to promote it just for promotional sake. We want your members to take advantage of these opportunities. So first, if you want to have your patients and community members engaged, we want to engage them in advocacy at the state level. Our Rare Action Network is hosting luncheons in Florida and Illinois, so in Orlando and in Chicago, near Chicago, in March and April. Please tell your members about these activities. Shoot an email to Rose, Ravellino, Rose Avellino at rarediseases.org. If you want some language to send out in your e-newsletter or on your social media, we would love your help in promoting this. Your members can come and get trained and meet other rare disease advocates where they live, but imagine getting free training on policy in the state, and then they can take that training and then work on specific issues on their own. So we train them on rare disease issues, and they can take that training and continue to do advocacy throughout the year. So please share this. Also, very excited, NORD is pleased to be working with Healthline to offer the Stronger Scholarship program for 2018. It aims to assist and empower college students making a positive impact on rare and or chronic diseases. Someone in your community could take advantage of a $5,000 scholarship. I'm sure that there are students in college and high school students, senior year, sending you letters, sending you stories, articles, really engaged, and maybe they are rare disease patients themselves and they want to do more in their college. Please encourage them to apply. More details are coming. We're going to send a specific email next week about this, so check your inbox and email us if you want more information and you just can't wait till next week. We're happy to provide that with you. Last but not least, we have Rare Disease Summer Family Camp. NORD is proud to once again partner with the Hole in the Wall Gang Camp, a rare disease summer family camp in Connecticut. The camp provides a special opportunity for children and families impacted by rare diseases to join together for a weekend of pure fun, free of charge. First of all, I don't know of very many camps that cater to rare diseases, and then second of all, this camp is free and open to 25 families who are located in the Northeast. It takes place May 31st through June 3rd in Ashford, Connecticut. Share this opportunity. We'd love to have you. So without further ado, I am very proud and pleased to introduce our panelists. We have 3 panelists. The lineup has changed since we scheduled it earlier in the year. We had a little bit of a shakeup, but we're really grateful for these 3 speakers to come, and we have a lot of questions that we'll try to get to in the end as well. We hosted a fundraising workshop during our summit last October, and afterwards, Susan Hedstrom, who you'll see pictured there, approached me in the hallway of the conference hotel and said, hey, how can I help? I loved this. I've got some fundraising experience. And it made me think we should do this again. This fundraising workshop that we hosted at Summit was so popular and well received that I figured we could do this as a webinar and bring even more people, people who couldn't come to the Summit, people who wanted to hear it again. And now we have a different set of panelists and 113 registered, 70 on the call. So different people are accessing this, and it's really great to have a recorded version of this that you can share with your development staff. So the way the format is for the rest of this session is each panelist will speak for 7 minutes, and then that way we'll have ample time for Q&A. We may not be able to answer all your questions. We may be speaking about different kinds of fundraising, so it may not pertain specifically to what you're interested in, but this is just a start, and we will keep going with this. So I'm going to introduce Susan Hedstrom, and I'm going to unmute her line. One moment. All right. Susan Hedstrom is the Executive Director for the Foundation for Prader-Willi Research. She is passionate about finding treatments for Prader-Willi and joined the foundation in 2009, shortly after her son Jaden was diagnosed with Prader-Willi syndrome. Rather than accepting that the syndrome as it has been defined, Susan chose to work with a team of proactive and tireless individuals to accelerate research in order to change the future of this disease. Inspired by her first conference for this disease and with the team of researchers that were working to find answers for the syndrome, she joined the foundation in 2010 and led the development of One Small Step Walk program. Under Susan's leadership, over $15 million has been raised for Prader-Willi syndrome-related research. Susan, you're unmuted. Thank you so much for joining us.
Thank you, Debbie, for the introduction. It is such a pleasure to be able to join this webinar as a presenter. I've had the opportunity to learn so much from other nonprofits, and I'm happy to be able to give back and help other rare disease organizations with their fundraising efforts. A little about our history. Let me see if I can figure out how to do this. Here we go. So FPWR was founded in 2003. When I joined in 2011, we were raising approximately $800,000 a year, and this is with a dedicated board but no staff. I came on just as we were dreaming up our flagship fundraising event, One Small Step, which was a national volunteer-driven walk campaign. And I did so at a part-time level for several years. While working about 20 hours a week, I was able to manage our database at a minimal level, grow our volunteer-led One Small Step Walk program, and support a handful of volunteer-driven fundraisers. So I've personally experienced growing an organization with little to no resources. Over the past 6 years, FPWR has focused our development efforts on growing our community. We're leveraging the dedication of our amazing volunteers and stewarding our community of supporters. Today, our annual revenue is between $3.2 and $3.7 million, and we raised this with a lean development team of only 3.5 team members. And that's if you include 100% of my time as development. I understand that most of you have little to no staff and are relying on volunteers to move your mission forward. Today, only having about 5 minutes left, my goal is to give you 3 tangible tips that you can implement at your organization today for free and with a limited investment of time. My first tip is to develop your communication base. This is going to become increasingly important as you grow, so having a strong foundation is very important. Whether it's an Excel spreadsheet or a sophisticated database, you must keep track of your donors and supporters. It's important to track who these supporters are as well as their relationship with your organization. Are they affected individuals, family members such as parents and grandparents, or are they donors and fundraisers? As you get more sophisticated, having this information will allow you to mine your database and segment your communications, which is a key for driving revenue for your annual campaign. Email is a free or nearly free platform for your fundraising efforts. Email is also in many cases your first point of contact for stewarding your donors. One question some of you shared previously is, how do you build a sustaining donor base when facing donor burnout? While you can't expect to retain 100% of your donors year over year, stewarding them through email and asking them to donate again will absolutely increase your bottom line. Everyone you have contact with, from donors to volunteers, should be in your database. Use your database to build your mailing list, that's plural. Start with everyone currently in your database, then continue to add contacts by regularly inviting your community to join your mailing list. MailChimp is just one of many email services that is free up to 2,000 contacts. These services can integrate with social media and your website so that you can embed sign-up forms and regularly invite your community to join. As you establish yourself as the premier knowledge source for your disease, more people will want to join your mailing list, and you will see these lists continue to grow organically. So next, let's talk about how we're going to use your database and email list to raise some money, because I think that's the reason why many of you are on this call today. Tip number 2 is to steward your fans. So you're maintaining a donor database, and you know who's in that database. Now it's time to segment your list and implement a communication strategy. A message to a donor is going to be very different from a message to one of your fundraisers or families. You need to customize your messages so that they are personal and targeted for each type of contact. This may mean that you need to send 2 or even 3, maybe even more versions of the same message depending on your different audiences. This is why in the previous slide I mentioned knowing your relationship with the people in your database. You need to use that to segment. Regular and frequent communication with your community is vitally important. Share your successes, thank them for their support, and don't forget to ask for a donation later. At FPWR, we strive to educate and thank 80% of the time and to ask 20% of the time. Even when we're sending out educational emails, include a donate button. We send out a quarterly research update to our entire database, and I'm always impressed to see several donations come in that day, specifically from that email, which only come in because we have the donate button there. We also schedule a number of specific email asks throughout the year, which include matching opportunities and days of giving. Some popular and successful times to ask for support include awareness days, like, for example, Rare Disease Day, or your Disease Awareness Day if you have one, as well as Giving Tuesday and the end of the year. My final piece of advice on this topic is to ask, and ask again. Chances are you are not sending as many emails as you could be, and you could be asking for donations much more frequently. When you're sending email solicitations, one email is never enough. For any given ask or campaign, plan a series of emails. I would suggest at least 3, and many more if your campaign is over several weeks. These emails can be pre-planned and scheduled, so you can work on these as time allows. I usually plan my email campaigns months in advance. So if you're relying on volunteers to do the bulk of your work, if you plan ahead, you know you have a giving campaign coming up, you could be planning these a quarter ahead of time, do them as your volunteers' time allows, and then have them scheduled well far in advance of the actual giving period. Finally, tip number 3 is to utilize Facebook giving. Facebook is free fundraising. Yes, Facebook is horrible at providing you information so you can steward your donors. However, 100% of the donor's contribution goes straight to your mission, and it's super easy to get your community fundraising. FPWR has spent a lot of time building our community and developing our peer-to-peer fundraising programs. The fundraising landscape has changed significantly, however, since November of last year. That's when Facebook removed all fees for Facebook donations. Expensive platforms that take 3 to 10% of what you raise are no longer a requirement for successful fundraising. This past January, when FPWR typically receives next to nothing in donations, we raised $5,200 on Facebook. Last month, we raised $11,000. This is without our staff doing anything. It just happened. We are continuing to support our traditional peer-to-peer fundraising. However, watching this trend, we now have a staff member tasked with stewarding every Facebook fundraiser. She begins by thanking them and friending them on Facebook. She then invites them to join our community if they haven't already. They do this by joining our mailing list and our blog. Our plan is to continue to steward these fundraisers all year long so that they will fundraise again for our organization. And maybe the next time it'll be on a larger scale. So finally, fundraising, it's most successful when you have a strong community, and much of our efforts at FPWR really involve supporting our community members, stewarding both our donors and our fundraisers, and encouraging action. Hopefully you can utilize these tips to help you continue to develop your community as well as your revenue base. I'm always happy.
I am Kelly Sitkin. I'm the Chief Advancement Officer for the American Brain Tumor Association. I have been with the organization for about 7 months now. I always like to start out with the mission of the ABTA, which is to advance the understanding and treatment of brain tumors with the goals of improving, extending, and ultimately saving lives of those impacted by a brain tumor diagnosis. We do this through interactions and engagements with brain tumor patients and their families, collaborations with allied groups and organizations, and the funding of brain tumor research. And I'm going to talk a little bit more about how we interact and engage with our brain tumor patients. But before I do that, I want to give you an overview of our advancement program. Fiscal year 17, our revenues were right around $5.6 million. Contributions are about 51% of our total revenue, and those include our annual giving, our major gifts, corporate sponsorships of programs, as well as foundation giving. Fundraising events are about 47% of our income. We host 9 5K run walks throughout the U.S. We have plans to expand those numbers in the next couple of years. This also includes our endurance fundraising platform as well as our volunteer organized fundraising events, which I will also touch upon. I wanted you to see also how we are staffed to raise this $5.7 million. I lead the advancement team as the Chief Advancement Officer. We have one individual giving manager who handles our annual giving program and also the cultivation and stewardship of major gift and mid-level donors. I have someone who focuses on building relationships with corporations, foundations, and pharma, and also handles the majority of our grant writing. I have 4 event staff. I have 1 manager and 3 event specialists. They oversee all of our BT5Ks. I also have 2 members in our volunteer network, and I'm going to talk a bit more about our volunteer network in the next few slides, as this is an important part of our long-term strategy to build grassroots effort and to build more meaningful relationships with our donors and with our constituents. I also have 1 gift processor. So, as I mentioned, we have 2 staff positions that are devoted to our volunteer network. And from a fundraising and awareness building perspective, the creation of the ABTA Volunteer Network has been and continues to be a priority of our organization. And our goal is simple. We want to reach more people in more places in more meaningful ways. And this heat map shows an overlay of where we have people that we are reaching out to that are either fundraising for us, or we're hosting a Partners in Treatment and Care meeting, or we are doing something in those areas or there's the BT5Ks. So, but what does it really mean to reach more people in more places in more meaningful ways? Well, what we want to do is basically create a major grassroots effort to bring the resources of the ABTA closer to individuals and families. And through this volunteer network, we would have the capacity and the platform to reach more people in their local communities and provide greater opportunities for families and patients to support each other. We really look to our volunteers to be ambassadors, to be fundraisers, to be our connectors in the community, because we really want to shift our perception of the ABTA as an organization of a Chicago-based office to really their partner in the brain tumor journey. As Susan mentioned, from a fundraising standpoint, how to utilize Facebook, we use Facebook a lot in terms of connecting our volunteers to one another. We have created small private groups where our volunteers can connect with each other, offer support, have guidance, and basically, have a platform for where they can talk about best practices, what they need from us, and what we can do to support them. So how did we go about creating this ABTA volunteer network? There's 4 components that we used to design the network. The first was building awareness for the program. We've been working on a volunteer recruitment strategy, basically an advertising strategy that we use through social media, Facebook primarily, as well as training our staff on volunteer management best practices. Because our staff has different interactions with different constituents, we all want them to be thinking about how do we encourage people to volunteer and identify themselves as a volunteer for the ABTA. We also want to increase the engagement of the volunteers that we currently have. So we want to enhance our volunteer experience by providing training and education to the volunteers through webinars, through special communications, and we also hold a monthly volunteer call. We also want to amplify our volunteer-driven efforts. Again, this is a lot of staff training that we do. I know it's sometimes easier, again, if you have staff, understanding that some organizations on this call do not, but sometimes when you have staff, it's easier to do things and just get it done. But what we really want to do is encourage people to reach out to the volunteers and have them be part of the process of any time we are initiating new programs or processes, to get their feedback so they feel more a part of what we are trying to do. And then also we want to cultivate our leaders. We recently implemented in the last 2 years a volunteer advisory council. We call them our super volunteers, and we identified people from different regions throughout the U.S. We hold an annual workshop for just those leaders, and we really listen to them. What they need, what are the resources they want from us, what assistance can we provide, and how can the ABTA support them in their efforts. And they've really become mentors to other volunteers that have signed up to volunteer for the ABTA. And then the last thing, along with the volunteer network, is our volunteer fundraising program. So it's called Breakthrough Your Way, and it's the 5th year of the program. We raise about $500,000 from this program. There are around 70 volunteer fundraising organizers who raise money for us, and we have a staff person who spends about half their time devoted to helping these folks by providing giveaway items. We also have on our website a list of resources that include frequently asked questions, ideas for fundraising, tips and tools for a more successful event. again, we've been utilizing our volunteer advisory council as mentors. So if we have somebody that calls the ABTA and wants to volunteer to host an event, we match them with somebody who is doing a similar event so they can get some tips for moving forward. And then acknowledgement letters. So we always provide some tangible items for people to be able to take into their community to let people know they're raising funds for the ABTA. So happy to answer any questions. Here's my information. Always willing to provide any of our resources. There's no sense in recreating wheels that already exist. So any of the resources that are on our website related to volunteer fundraising and FAQs, please feel free to edit and utilize however you would like.
Thank you so much. Can I be heard?
Yes.
Okay, terrific. I'm really sorry. My line was manually muted and I didn't realize that. So I apologize for that. That was a very excellent talk. You and Susan really did bring a lot of good tips for how an organization with limited resources can maximize fundraising. I wanted to properly introduce you, and I think I was speaking not realizing that I wasn't being heard. But thank you, Kelly, for bringing more than 15 years of development experience, including strategic planning and major gift solicitation and community-based fundraising and development to this presentation, and for sharing so freely your contact information. I'm sure that you will get people reaching out to you. And we do have some comments that we will share in the Q&A. But now it is a great pleasure to introduce our final speaker, who I will unmute now. Don Kraus is the Vice President of the Board of Directors, and that's a volunteer position at the Multiple Systems Atrophy Coalition. We had last-minute changes in our panel, and Don had mentioned very late last week that he was available to speak, and I said, no, we have 4 panelists. I'm sorry. We just have too many speakers. And yesterday when I found out that our panel changed and we went from 4 to 2 speakers, I called Don up and said, I know it's only 24 hours, but could you speak? So he doesn't have slides, but he will speak about his experience in fundraising. He has 2 decades of experience in the MSA community, and he was a strong supporter in 1998 and was invited to join the board. And thanks to the efforts of their board, they have grown tremendously and are actively funding MSA research grants. Don, thank you for joining us with 24 hours advance and saying yes to doing this yesterday on your birthday. So happy belated, and you are now free to share your experience in fundraising.
Thank you very much for inviting me to join today. I was able to scrub together some notes this morning, and so I'm ready to roll. The Multiple System Atrophy Coalition was founded, we incorporated in 2004 and received our 501c3. And from the period of 2004 through 2011, we were raising $10,000 to $25,000 a year. We were also known as the SDS MSA Support Group. And so in 2011, 2012, we decided that we really wanted to become a much bigger organization with a multi-pronged pillar statement. So we changed our name to the MSA Coalition. We developed a scientific advisory board and set up a research grant program and really started advertising that to our donors while also expanding our ability to fundraise and also receive donations. So in 2012, we raised $50,000, which we were really happy about, but by 2015 we were raising over $1 million a year. And now we've, as Debbie mentioned, we've funded 36 different research grants from around the world for more than $1.7 million. And our goal is to continue to increase that. We've really hit a little bit of a plateau over the last couple of years in our fundraising, so we're implementing plans now to become a more efficient fundraising machine to better support our community. Our primary revenue sources come from 4 key areas. About 10% comes from corporate grants and sponsorships. Those come from pharmaceutical companies that are developing or have developed treatments for conditions that are involved in multiple system atrophy, and also from medical equipment companies like wheelchair manufacturers, et cetera, blood pressure device companies. We also receive about 30% of our donations from individuals that come through in honor of, in memoriam, or directly from patients and caregivers that are immediately impacted by multiple system atrophy. About 10% of our money comes in from live fundraising events, and we have this earmarked as a place where we could potentially expand. Right now, we allow the use of our logo when certain conditions are met, and we have individuals that either set up their own foundations or set up other financial vehicles to run the finances of their fundraising events around the United States, and they donate the profits to the Multiple System Atrophy Coalition. Probably our biggest and most successful way of fundraising over the last few years has been through third-party fundraising tools. Our biggest one is CrowdRise. We also use First Giving. That was the first one that we started with. We still maintain a presence there, and we're expanding greatly into Facebook at this point. As it was mentioned, CrowdRise and First Giving, some of those platforms can have pretty big fees. We've been able to negotiate and lower our fees substantially because of the amount of money that we're raising on there. And they also offer a very nice little click that each donor can make where they can cover, the donor can elect to tack on the fee at the end of their donation. So we get the full donation amount, and the donor covers the transaction expenses. And I'd have to guess, but I would say that probably somewhere in the neighborhood of 90% of the people that donate select that option. And so we're collecting almost 99% of all of the donations made through CrowdRise to our organization. So with that said, I want to go through some of the best practices on CrowdRise that we use and that I think are also applicable to other third-party devices, tools, and even if you're have your own platform set up on your website through companies like Click and Pledge or other groups, I think these are applicable. But I just want to mention one thing for CrowdRise, and it's something that's been extremely helpful for our organization, is that we've participated each of the last 4 years in their annual holiday challenge that is usually sponsored by an outside organization. So this past year it was sponsored by the Newman's Own Foundation. And the MSA Coalition finished 5th this year. In previous years, we finished as high as 3rd. And actually today, my wife just opened up the check for $17,500, which was our 3rd place prize money, which also more than offsets any expenses that we have through CrowdRise. And since 2013, we have raised nearly $900,000 on CrowdRise, with 2017 being our strongest year ever. And the vast majority of that money that we raise each year comes in the last 6 weeks of the year, starting on Giving Tuesday and running through the 6-week holiday challenge that they use. So some of my best practice tips for CrowdRise and other third-party tools is that it's really important to leverage the companies themselves. CrowdRise in particular has an outstanding staff that's really energized. They seem to really love their jobs. They're always extremely responsive, responding to emails almost immediately and phone calls. And so they'd be a huge resource if you want to evaluate CrowdRise, or if you want to get set up in actually using it. They can make it very easy to get the whole process underway for your organization. I think it's also critical to build a team from within your group of volunteers. Our organization is entirely run by volunteers. Our board members do the vast majority of the work. And so for the CrowdRise Holiday Challenge, we've developed into a team of 2 people. We have one person that really focuses on recruiting, bringing fundraisers in, and then I tend to focus more on content development around our messaging and also in coaching fundraisers to be more active and to be able to raise a little bit more money. And I think those are probably the 3 key functions that you really need on a team of volunteers. Be sure to use the tools that these platforms provide. CrowdRise has outstanding pre-written emails, press releases, images, other things that you can use during your events, especially during the annual challenge. They have weekly pre-written emails that you can customize and send out to your database of people. Like the other organizations, we maintain about 10,000 people on our MailChimp mailing list now, and that's an incredible way to activate our fundraisers. It's also critical, and I think this is important across all fundraising efforts, to leverage the emotional power of having a rare disease. When you're setting up these third-party fundraisers, as an organization, we now create special videos for each event, and write text and provide images that try to spell out the emotional impact of multiple system atrophy on a person and on their families' lives. And then as people become fundraisers for us, we encourage them to also tell their story from their own perspective because that emotional appeal is so important. We also create guides and articles that we put in our blog post, and we send those out via our newsletter and on Facebook pages that provide all kinds of tips. So basically, crowdsourced fundraising 101, where we're talking about the tips like using emotional impact. Somebody mentioned earlier, ask again and ask again and ask again. That's another critical tip. It's just really important to be persistent, especially during the holiday season. People are really busy. One email or one social media post just isn't going to be enough to activate more than a tiny percentage of a person's network. So being persistent is critical, but we've also found that it's really important to be balanced with really good, valuable content. That's going to help the patients and the caregivers inform other people about the disease. It can't all be about fundraising. And so setting up a content plan during any extended period of fundraising is critical so that everything is planned out and you get the information out to them as quickly as possible. And then beware of fundraising fatigue, which I think addresses that. Unfortunately, people do get tired of receiving a lot of emails about fundraising. I find that it's a very small percentage of people that complain. It's probably a bit bigger people that are bothered by it. But the reality is that every single email we send out and every single Facebook post we make generates new fundraisers and new donors for us. So it's just critical to find that balance to really be successful and to upset as few people as possible.
So Don,
I think lastly, yep.
Oh, sorry. Actually,
am I over time?
You've got a minute, and it sounds like you have one more good tip. So keep going.
Okay. Yep. So I just have a couple practical fundraising tips that I think are really applicable across all fundraising methods and even for obtaining individual donors. And one is that you have to have a really clear mission. Our mission prior to being able to raise a lot of money was not well spelled out, and it didn't really meet the needs of the patients in our community. Everybody wanted support groups, but they needed a lot more than that. And so when we expanded our mission from being just a support group to really being the leading charity in the space for funding research, it vastly improved our ability to fundraise, and we made our mission very clear that that was what we were going to be doing. It's also incredibly important to be transparent. You need to publish your financial documents and get those validated and to write out an annual report so that people can make easy sense of them. Bigger donors are generally more sophisticated, and they want to make sure that their donation isn't going to 95% operating expenses. I think a really good target, kind of a minimum target, is that at least 80% of your donations need to go to other things besides operations, and the real goal should be 90% or more are not going to operating expenses. And then lastly, I just recommend getting your organization to be validated by third-party groups. There are 3 that are very easy to use, and 2 in particular that I recommend for smaller nonprofits. One is Great Nonprofits. It's a very easy way to get a badge on your website. It basically asks donors and people in your community to write reviews of your organization, and if you get a certain number of 5-star reviews, you get the badge for your website. So it's a pretty low barrier to getting it, but it adds a lot of credibility. And then GuideStar is the second one that smaller organizations can partake in. It does require that you put in financial documents, even if it's an easy 990 form. But as you get bigger, you can include more documents, and you can go from, you can get bronze. We're now a platinum level GuideStar, and a lot of people use that to validate us. And then the last one is Charity Navigator. They do have a minimum of $1 million a year in revenue in order to qualify for their review. So that's just something to keep in mind, but they're probably the most trusted of the 3. And with that, I will turn it back to Debbie.
Thank you so much, Don. That was really helpful. I loved all your very specific suggestions for software and your tips for fundraising. We have a bunch of questions that are in the queue. Our panelists are unmuted. If you'd like to submit your questions, you can do so using the chat function. Our first question, we do have some suggestions, but our first question is fundraising via Facebook. Where can we learn how to do it? How did you learn how to fundraise on Facebook?
So I guess I can jump in.
Go ahead, Susan.
A lot of what we do is trial and error. We've been learning Facebook as Facebook has been growing and it changes on a regular basis. We've implemented a strategy where we try to, give encouraging posts as well as educational posts and blogs, and then we throw in some fundraising requests. Honestly, the Facebook fundraising that's been taking place has been very organic, and I think now it's simply letting people know that this is a viable option for them if they want to get involved and fundraise for your organization. So posting on Facebook that they can donate their birthday to your organization, or if they want to get involved and take action, they can fundraise through Facebook. And again, reminding everyone that 100% of the donation goes to your mission and is not taken out in fees.
And I would just add to Susan's comments, there's also a section on Facebook that will walk you through kind of the back end of how these things work. We're an organization that actually doesn't encourage the use of Facebook because it's hard to steward your donors. You get the amount in lump sum, but I think it is a viable option for small organizations to do that. And again, I'm all about not reinventing the wheel. Look to see what other organizations are doing, such as asking people to donate to, in lieu of their birthday. It's an easy way to do it, and encouraging people when you post something about a nonprofit on your Facebook, a lot of times it will prompt you and ask you if you want to create a fundraising page.
Yeah, I would just suggest we're learning how to fundraise on Facebook now. So I think those were excellent suggestions, and I just Googled how to fundraise on Facebook, and there's all kinds of great resources. So that's something I would recommend doing.
So the next question, we have so many great questions. So maybe we'll just, if we can just do like a quick soundbite on the response to this. What was your organization's revenue level when you hired your first hire who was dedicated to development?
I will answer that. I don't know. I would have to find that out. So I saw Kathy on here was a development director for ABTA in the 90s. So we've at least had somebody on staff since then. But I can follow up and answer that question.
Thank you. Don?
Well, we're actually in those discussions now about potentially doing that. I guess I would just say that I think you have to have a demonstrated track record of being able to raise a certain threshold of money. We really don't want to push our operational expenses way up and then harm our charity's reputation as we do so. So, depending on what you think you can hire somebody for, you kind of have to do the math on how much money you've been able to raise on a regular basis annually and see if it makes sense for you at that time.
Great. Okay, so our next question, this one's a good one. It sounds like a lot of these directors use volunteer fundraisers. I do the same, but we have had issues with, quote, difficult fundraisers wanting to do things their way and not follow best practices. Any tips to help guide them and not upset them?
Well, we offer if we're having outside fundraisers doing their own event, so a bike ride or a bowling event, or we had a car auction type event where classic old cars were there, more of a car show than an auction, I would say. We have a document now that we require those events to sign off on before they can have a sanctioned MSA coalition event, so that we have basically in writing that they're willing to follow our guidelines.
I would say to Don's comments, we do as well. We have an application process. And then quite honestly, I mean, the reality is that volunteers will, on occasion, want to do things their own way or not follow the guidelines. When it's practical to have, we have a staff member that regularly talks with them, coaches them, tries to redirect into the best practices. Again, what we have found is helpful is when we can connect them directly with a peer. So, if there's somebody that's doing a bowling event, we try to connect them with somebody else that's done a bowling event. But Again, we do ask them to sign a document that states they will follow these best practices.
Thank you. So we are almost at the hour. I think we have time for one more question. I'm going to look at the questions that we collected. We have 3. Okay, so 2 of the questions are very similar. One is, how did you get families to reach out to your networks? And the other one was, how did you begin to build your volunteer network? So kind of the same. How did you get started building a volunteer network?
So we had early success by meeting affected families in person. One of our board members was the most social, gregarious person you will ever meet, and she literally traveled from city to city, meeting with families and inviting them to, participate in a special opportunity, which was essentially hosting a walk in their community. She herself had done it, so she had that personal, if I can do it, so can you message. And that was very, very powerful in those beginning stages. Now that we've grown out of our infancy, we're actually utilizing inbound marketing as one of our strategies for attracting new families and nurturing them into fun.
This is Kelly. We are doing the same. We encourage by, again, trying to highlight. Every month we highlight a different family or individual who has hosted a fundraiser. We try to do webinars occasionally to talk to our volunteers about how they can be of assistance. We always try to encourage, again, it's not all about the fundraising. We have other volunteer opportunities for people to contribute to the AVTA, but it's just an ongoing conversation and part of our conversation that we have with donors. We also do a lot of marketing through people that come to our website or through our Facebook pages.
Yep. All right. That is unfortunately all the time that we have for questions. Thank you so much to our panelists for joining us and for giving us your time and your expertise and your experience. Susan Hedstrom, Executive Director, Foundation for Prader-Willi Research, Kelly Sitkin, Chief Advancement Officer, American Brain Tumor Association, and Don Kraus, Vice President, Board of Directors with the MSA Coalition. It's been a great pleasure. I would actually like to consider that our Facebook page has over 200 executive directors, board members, and leaders that we institute something like a fundraising Friday where our staff at NORD, Lori Oppenheimer and myself, post one of your questions, and that all of the members on our Facebook page can respond to those questions. So any question that has not been answered, we will get to one Friday at a time on our Facebook page. Thank you, everyone, for joining us. If you had a question that didn't get answered and you can't wait for Fundraising Friday, you can email membership@rarediseases.org. When this call is finished, you'll receive a pop-up window with a quick one-question survey for your feedback. Thanks for taking the survey. Every benefit, every resource that we mentioned on this call is included in our Member e-newsletter. If you do not get that, please send an email to membership@rarediseases.org, and we look forward to meeting you at future webinars and calls. Thank you so much, everyone, for joining us. And thank you to our panelists. Have a wonderful rest of your day.